My name's David Beard. I'm an exercise physiologist. I specialise in the area of metabolic health and healthy ageing. I've been working in this profession really longer than the profession existed. Before exercise physiology was kind of a profession. So I've been working in this area for over 40 years. I've worked in aged care for over a decade. I've worked in adult health and fitness. I've written a little book on healthy ageing. And I've worked specialised in the metabolic health space probably for the last 10 to 12 years. And I work at HFRC in Nedlands, Western Australia. I'm one of the owners here, have been here for about 10 years. I think one of the best things I did in my career was when I was a student, actually. I ended up getting much more interested in the health side of things and went to the United States to do my master's degree, where the qualification was more around health, preventive health, adult fitness, than was available in Australia. I was very lucky when I first got back to Australia. I was working with one of the big health insurance companies. And 3 years into that, I got asked to go and talk to an aged care organisation. They knew I'd been working in adult health and fitness. I spoke with them and they actually decided to employ someone. I was probably the first exercise physiologist ever to work in the aged care industry. I worked in that industry for about 11 years, working with older adults, and I mean 80s, 90s, over 100. So that was a real turning point that got me interested in that whole impact of exercise as we get older. And I think the second turning point for me led me to what I'm doing now, where I got interested in the area of metabolic health, diabetes, weight loss, PCOS, inflammatory conditions. And I was lucky enough to get involved with a company here in Western Australia that's developed some metabolic testing that allows me and gives me the tools to guide people to help them become more metabolically healthy, which I think is one of the key factors as we get older and is one of the drivers of chronic health conditions in Australia, poor metabolic health. I really love the opportunity to help people improve their health. I know that sounds kind of cliche, but once I get in the clinic, I get someone in front of me, I just focus in on how can I help this person to improve their health, specifically around their metabolic health, particularly as they're getting older. Being someone in 60s myself, I realise the importance of being, one, metabolically healthy, but also being fit and strong. Working with them to help them design strategies around exercise, around nutrition, around lifestyle that can help them stay as healthy as possible for as long as possible. I've been the state chair of Exercise and Sports Science Australia in WA for a number of years, and I've been especially strong in the lobbying area. Our professions, I feel like we're still working on getting as credibility that some of the other longer term professions have got, and working with government to try and help them see the benefits of what our profession can do, both in preparing people for surgery, for example, helping them manage chronic health conditions. I think our profession, I think all allied health, but particularly exercise physiology, can play a key role in helping the chronic disease crisis that's impacting all around the world, but especially here in Australia. And I think that could take a large burden off the the tertiary care system, the hospitals, emergency departments, etc. I think there's two key things, and it's probably the things that I focus in on because of the areas I work in. But people are becoming much more conscious of what metabolic health means and how their body responds, how it produces energy and how it uses food to create energy, and how that impacts so many of the systems and organs and physiology of the body. So people are becoming a bit more aware of that. Hence, I guess, the reason that I specialise in that area. I'm fascinated with the whole physiology and biochemistry of how our lifestyle and our choices impacts that, and how that can contribute to good or poor health. And I think with an ageing population, I'm seeing more and more older Australians realising that if they want to enjoy good health as they get older and enjoy the lifestyle and the things they want to do, they actually have to pay the price and do some work. And that means, getting some exercise on a regular basis, doing the bit of work, coming into the gym and getting stronger, and also eating well and making sure that they're making good decisions every day that allow them to enjoy the things they want to do in life. I really get pleasure out of helping people learn about how their body works and how the choices that they make day to day can make such a difference to the rest of their life. I kind of tell my clients, listen, you need to invest an hour a day minimum on staying fit and healthy as you get older. And I try to educate them about how do you get the best bang for your buck. What's the least amount you need to do to get the result that you want, so you're working efficiently and effectively to stay as healthy as possible. So that pleasure I get out of helping individuals is what keeps me coming back to work day after day. I never get sick of it. Once I'm in here with a client, it's like everything's focused on how I can help them and help them get the best result for their health. I think the most important thing in any career, but particularly in the health career, is find something you're passionate about where you really feel like you are making a difference to the individual that's in front of you right at that point in time, but also a difference to the community. I kind of see that the work that I do, both as a practitioner but also in lobbying governments, etc., is to try and help the health system be as effective as possible. And a really good health system is not one that's got overcrowded emergency departments and full hospitals. It's actually one where we don't need so many hospitals. So my job is to try and my passion, I guess, my drive comes from trying to keep people out of the hospital system, away from doctors, so that they're enjoying good health for as long as they can.